welcome to BizTech's Health and Wellness Show, where we equip you with tools to improve your health and productivity, and also those of your family and your co-workers, employees, you name it. You can have that possibility of better productivity and better health. I'm Jason Dacey in Australia.
And I'm Brian Fernandez, speaking to you from KL, the co-host.
Today, we're going to be talking about digestive health, and in particular, liver health. And we have two foremost experts from Sunway Medical Centre in Kuala Lumpur to talk about that. I'd like to welcome Dr. Chung and Chien and Dr. Teoh Leng. Welcome to the show.
Thank you,
Hi.
Jason.
Tell me about your specialities.
I'm a hepatologist and gastroenterologist in general, and I do manage liver disorders as well as digestive disorders.
How about you, Dr. Teoh?
I am an endocrinologist, so my main specialization would be anything to do with hormones and diabetes.
Now, Dr. Chung, let's start with you. Can you just give us an overview of how our digestive system really works? Where does it even start?
All right. Okay. So the good questions. Okay. Essentially, our digestive system consists of two important elements: the GI tract as well as the solid organs of the digestive system, where very often people do not know their existence. All right. So very often people do know about the existence of these hollow tubes called the GI tract, which consists of the mouth up to the level of the anus. So digestion starts from the mouth, then propels the food all the way down to your esophagus, to your stomach, from there to the small intestines, to the large intestine, and any solid waste will be excreted from the anal regions. And the solid part of the digestive system consists of our well-known liver. Liver plays an important role in our digestion as well, including our gallbladder as well as our pancreas. So this makes up the solid organ of our digestive system. So all in all, as a whole, including together with the GI tract, the hollow tubes, as well as the solid organs, it plays a vital role in our daily digestion. So digestion is very important because whatever that we consume, regardless of the water, the minerals, vitamins, including the carbohydrates, proteins, all will be digested and absorbed for the daily use in our body system.
Well, Dr. Chung, I know that you've got a speciality too with liver transplants. So talk
Correct.
about the significance of the organ and when it comes to transplants and your overview of that.
Right. Okay. So as for the liver, apart from being having an important role in our digestion, we all are very aware that liver helps in detoxifications of whatever we consume. So whatever that goes into the digestive system, all will be absorbed and through our intestine and goes through the liver. So the liver helps to detoxify these substances into a non-toxic substance excreted in the urine. But apart from the main role of detoxifying, liver plays an important role in many other functions. For instance, productions of a carrier protein, what we know as albumin. Albumin is very important protein in our body system. It helps to carry hormones, it helps to carry fatty acids, including medications for use in specific part of our bodies. Apart from that, liver actually helps in the production of what we call as coagulation factors. It's not really a protein per se, but these coagulation factors are important in helping blood clots. So say if we have an injury, a cut on our hands, so very often the bleeding stops in time, right? In a short period of time. So liver plays an important role in producing this coagulation factor together with our platelet. It helps in stopping the bleeding. So when there's a liver disorder, our coagulation system tends to be, in a way, haywire. That leads to excessive bleeding or bruising. So another role of our liver is that it helps in clearing off the excessive bilirubin. Bilirubins are basically what we call as the yellow pigment that is produced by degeneration of our aged red blood cells, and the liver helps to clear them. Otherwise, we will find an individual to have jaundice if the liver is not working at its best. So apart from that, there's also another role of liver in the immune system. So liver actually helps to identify virus and bacteria that has managed to gain entry into our system through our digestive system, and segregate them and activate the immune system to identify it and destroy it. So there are, in a way, multitudes of functions from the liver apart from just detoxifying. Teoh said, the main role of detoxifying that we all well aware of. So there are many other functions that we are not aware of. So liver is one important organ in our system that works over time, in a way, 24/7, constantly. Whatever that we consume, all has to be passed through the liver, and the liver has to work at its best to clear what is not necessary for the use of our body.
Now, based on what Dr. Chung has said, I think one of the key things is food intake is going to have a big impact on our liver. Now, Dr. Teoh, could you share some insights into some of the chronic diseases that may be caused by our eating habits?
So our eating habits over the years have clearly changed. So if you think about our great-grandparents, for instance, they probably eat a lot less processed food, and they probably have got jobs that are a lot more physical, whereas nowadays we are all very office-based and we are very sedentary. So the prevalence of obesity has markedly risen in the whole world, okay? But in Malaysia in particular, if we look at the statistics from the National Health and Mobility Survey in 2019, 50.1%, so half of our population have a BMI of above 25.
Yeah, we are the fattest country in ASEAN.
Correct. We are
and
the
Australia's
fattest.
not far behind either. I think we're pretty fat too.
Yes. So this is Malaysia boleh in the wrong sense of the thing, you know. So of course, with the increased prevalence of obesity, we also see other chronic diseases that come with obesity, such as diabetes, high cholesterol, hypertension, so high blood pressure, you know, and other things, you know, immobility, arthritis, you know, heart disease, strokes, and all that. Okay, so all of this come at the back of obesity. Now, if we think about obesity, why do we get fat? We get fat because we eat too much and we exercise too little. So if we look at the same survey, the National Health and Mobility Survey, 1 in 4 of us exercise, for example, regularly. So that is the problem. So we don't exercise at all. And the recommended duration of exercise in a week is actually 150 minutes. So how many of us do that?
150 minutes is a lot. Okay.
In a week. Yeah. Okay. So that is the sort of gold standard. And interestingly, in the same survey, 95% of Malaysians don't eat their 5 portions of fruit and vegetable. 95%, only 5% eat the recommended fruits and vegetables. But if you think about it, our national dish, the nasi lemak, there's no vegetable there. There's two slices of cucumber and that's it.
Then that's it. Yes.
Yeah. So you know, 5 portion of fruit and vegetable, we never really achieve that. And then the last but not least is sugar in our drinks. You know, we love our teh tarik, you know, and in the modern generation, their bubble tea, you know, so all of that contributes, and therefore we are growing sideways.
Well, Dr. Chung, can I ask you, you know, some of the cases that you've seen, you know, where liver problems have manifested themselves in patients? Perhaps you can share 1 or 2 case studies where you've seen an obvious liver problem.
All right. I suppose you're asking about the common liver disorder you find, right? Okay. So among my patients, very often I do find those with liver disorder problems that occurs in the liver, right? So with individuals with viral hepatitis, right, caused by hepatitis A, B, or C. And we do have immune-related liver disorders. There are names for it. It's known as autoimmune hepatitis, primary biliary cholangitis, and even primary sclerosing cholangitis. These are all autoimmune-related. And a few others to name. To name a few. fatty liver is definitely one of it, all right? Especially so when it's in relation to obesity and diabetes. As far as I'm concerned, 50% of individuals with diabetes have fatty liver, right? I see them very often in my clinic setting. Obese individuals, individuals with metabolic syndromes are those with high blood pressure, high triglyceride, cholesterol in a way, and of course, increased waist circumference, or in other words, obesity. So we do find a lot of them with fatty liver, and fatty liver are often without symptoms to start off with, and very often they are picked up by incidentally from the elevated liver enzyme from their routine blood test. But there are few individuals with fatty liver, or now we actually call it metabolic associated fatty liver disease. Back then, it was known as non-alcoholic fatty liver disease. To distinguish it from the intake of alcohol, we do know alcohol can cause fatty liver, but now we are looking into data that individuals with metabolic syndrome, particularly so obesity and diabetes, they have increased incidence of fatty liver in them, despite having normal transaminases, means that the liver enzymes are absolutely normal from routine blood tests, and only to be discovered to have fatty liver through ultrasound, imaging studies, could be CT scan or MRI, but very often it's through ultrasound. Of course, ultrasound alone is not enough to stratify the severity of a fatty liver, because it only tells us that if the individual has fatty liver. But as far as I'm concerned, only individuals with more than 30% of fats accumulated on the within the liver cell can only be picked up from the ultrasound. So of course, if you ask me what are the best way to determine if one individual have fatty liver, of course the gold standard would be liver biopsy, but liver biopsy is invasive. Yeah, so but of course nowadays we have a lot of modalities, either the physical or biochemical modalities, in order to determine the severity of the fatty liver and risk stratify these individuals with fatty liver. So just to name a few of those biochemicals modalities, we call it nephrofibrosis score, we call it FIB. So there are a few others. And of course, we do have the physical part of it. Apart from ultrasound, there is a particular scan, we call it as fibroscan. And of course, we do have FibroTouch as well. These are to measure the liver stiffness measurement. And the CAP score, which is known as the controlled attenuated parameters, will give us an idea of the amount of steatosis one individual may have. An individual confirmed to have fatty liver. And this actually sort of correlates with the percentage of the of fats within the liver cells, and somewhat validated to liver biopsy. So it's as good as individuals to have undergone liver biopsy.
So Dr. Chung, one of the key things with this is obviously the problem is a much bigger problem than we realize. Many of us have many of these.
All right. Yeah.
So how do we then, what are the tests that we can do, especially if we are above 40, for example, or we found we have relatively unhealthy lifestyles, or we eat too much, as you pointed out, too many sweet things, too much nasi lemak. What are the type of scans that we can go and perhaps do with specialists like yourselves that will then kind of help us to understand where we are at?
I think to start off with, one have to understand what are the risk factors they have. So I would strongly recommend, if an individuals have underlying metabolic issues, for instance, diabetes, obesity, it's best to have a blood test to start off with. All right, blood tests can be as simple as a liver function test. This is to determine if the individuals have any elements of inflammation, or should I say elevated liver enzyme. So if there is inflammations or elevated liver enzyme, then in order to determine the cause of it, of course, a few things that we need to run through before we blame it entirely on fatty liver, before we run through the screening for fatty liver. So we run through the usual test itself, because in Malaysia, we do have a high prevalence of viral hepatitis, for instance, hepatitis B and C. So we have to rule this out first to start with, and then some simple tests to ensure there's no elements of autoimmune hepatitis before we proceed to ultrasound. So ultrasound will be able to let us know if the individuals have fatty liver, okay, based on the findings of increased echogenicity. Apart from that, ultrasound will give us either to rule out other causes, for instance, cancer of the liver, all right, and including the stage or severity of the liver, because at times we do have individuals who have fatty liver for a long period of time, and with the ongoing inflammations or damage to the liver cells, eventually it leads to scarring of the liver. Yeah, so scarring of the liver is termed as cirrhosis, and this takes about, depending on how bad the underlying condition is, or how bad of the amount of steatosis. Steatosis means the presence, accumulation of fat within the liver. So if an individual has a high amount of steatosis, which have led to what we call a next stage before the cirrhosis, I would say the worst stage of fatty liver, because it's always started off as fatty liver, then it moves to what we call as non-alcoholic steatohepatitis, in short NASH. So this is a stage where we have to be very aggressive with a particular individual, because this stage tells us that, look, the liver is damaged, heavily damaged, and is replaced by fibrous scar or tissue of scar tissue. So eventually this will take on and progress to liver cirrhosis. I know liver cirrhosis also has its own stages. We sort of call it Charles score. The Charles stages, Charles A, B, C, and the final stage with C being the worst. So it really depends on which part of the cirrhosis. Once it goes into decompensated cirrhosis, means the liver has already stopped functioning at its best, with the synthetic function impaired. So complication will set in. So complication, for instance, build-up of fluid in the abdomen, vomiting blood because of increased pressure in the liver, cause the distension of blood vessels between our digestive system, and jaundice, which is apparent from the white part of our eye, the sclera. So these are all complications as a result of liver cirrhosis. So it is important to determine which stage this patient is at, and be aggressive with the treatment, identify all the risk factors itself before the patient progresses to liver cirrhosis.
Yeah, I've definitely heard about that. Look in the eyes, you can see that. But Dr. Teoh, I want to ask you about a couple of words that I've heard in association with liver disease: exocrine and endocrine, and what digestive organs are categorized into such.
So the pancreas has two functions, mainly the exocrine function and the endocrine function. And exocrine function means the release of digestive enzymes through a ductal system to help with digestion. Whereas the endocrine system is basically a secretion of hormone directly to the bloodstream. So in the pancreas, there are a few hormones such as insulin and glucagon, which is used to manage blood sugar. So how does the digestive system affect endocrine system? So I see a lot of diabetes patients, okay? And diabetes patients at the start, we manage their sugars to make sure that they don't get complications like heart disease and strokes and all that, okay? But actually, if somebody has diabetes for a long time, so when I mean long time, I mean 20 years, 30 years, 40 years, the high sugar levels that they have had for such a long time affects their nervous system, okay? And it affects their nervous system in a sense that their feet might get numbness and tingling, which is quite common. But the more uncommon one would be they affect what we call our autonomic nervous system, which is the nerves that supply things like breathing, blood pressure, digestion, okay? So they can have what we call gastroparesis. So paresis essentially, what it means is gastro means digestive, and then paresis means like weakness, right? Weakness, and arm is all weakness. But in the sense of a stomach, is that the food that is swallowed sits in the stomach for longer than normal. So meaning to say, our normal person would probably digest the food the moment the food starts, touches the stomach, it starts digestion. Whereas these people with gastroparesis, it sits there doing nothing. But you just imagine it's almost like a garbage bin, right? Because when you put a garbage bin, then, gases start forming and all that. So these people feel very uncomfortable, very, very uncomfortable. They feel, nauseated. Some would proceed on to vomiting. They just bloatedness. They feel extremely uncomfortable. And actually, this discomfort It's not just from one meal. It is just all meals. So this is quite difficult to treat, to be honest, because there's almost very, very few things that we do that really makes a significant difference. So actually the moral of this story is make sure that if they have got diabetes, that their sugars right from the start, so that if they get this kind of complications, it's like way, way, way down the line, you know, because the duration of which it starts really depends on how good or bad control is at the start. So that is one that could cause sort of digestive system. Other things like medicine. So in diabetes, we have lots of medicine, but one of the medicine, metformin, can occasionally cause abdominal bloating or even diarrhea. So that can cause so discomfort in your digestive system. Then there are other really rare things like, you know, the opposite of diabetes, which is a rare tumor called insulinoma, which can cause low blood sugar, but that's extremely rare, like we rarely see it. The other things that towards the end of people who's had diabetes, you know, they also suffer from either constipation or diarrhea or fecal incontinence, again, something to do with the autonomic nervous system. So these are some of the things that I can think of at the top of my head, whereby endocrine and digestion do have a link. But of course, the most common link we have really is fatty liver. Fatty liver, because like Dr. Chung said, you know, almost half of the people with diabetes will have fatty liver. So that is the most common thing. And actually, Asians, we don't handle fats as good as Caucasians. Okay, so there have been studies that have shown that they have compared a Caucasian person who is 80 kilograms versus a Chinese person who is 80 kilograms versus an Indian person or South Asian that's 80 kilograms. Okay, the same height, obviously. So BMI is the same. So same height, same weight. Okay, for a Caucasian, they are, I can't remember how many percent, but like something like 6% or something like that. Okay, a Chinese person is for the same height, same weight, they're 3 times more likely of developing diabetes. And for the Indian person, it's about 2.5 times. So we as Asians, we don't handle fats as well as a Caucasian. So even the BMI of 25, that's too high for us. You know, actually we should be following the target of 23.5. So some people with fatty liver that we see in our clinic, we are like, oh, you're not that fat. You know, you're not that obese. But yet they have fatty liver. Versus the white person, they are really quite obese. And then you see the fatty liver.
It's actually, if you say that, Dr. Teoh, it's my wife's Chinese, and she always says, you know, you can take food that I can't take, you know, so it's you know, fried food and all that. So it's interesting that you make that point.
I want to ask Dr. Teoh, both of you, a couple of questions around lifestyle. Now, what is the common impact of the liver and digestive system on stress, or how does stress impact the liver and digestive system, especially because, you know, many of the our audience on BizTech are corporate people, and stress really is a big part of their lifestyles. Could you share some insights into some of the challenges that people face because of stress?
So the famous saying is that the GI tract mimics our emotions. You know, that's you know, like things like butterflies in your stomach. So when you take an exam, butterflies in your stomach, you feel like you need to go to the toilet because it mimics your emotion. You're nervous. Okay, so in a way, I suppose stress, it depends on individual, how they respond to it. Some people, they manage stress by eating. So they comfort eat. So what happens? Then it's obesity, right? And on the opposite is true. Some people, when they're stressed, they can't eat. So then they start losing weight, and then they have problems with their, what they call gastric, you know, and things like that. So in a way, stress affects the digestive system. I'm not so sure about the liver, but maybe Dr. Chung can enlighten us.
I think not so much about the liver, though, but It really depends on what we consume. As I mentioned earlier, whatever we consume goes in the digestive system or be absorbed and then goes to the liver. So, I mean, the facets of the modern lifestyle of, I mean, irregular meal time, lack of sleep. I mean, on top of that, stress, poor physical emotions, so on and so forth. All this could lead to, I mean, unhealthy lifestyle. I mean, I do know a lot of individuals have been popping themselves with multiple supplements in hope that they will be able to, I mean, to supplement what they are lacking because of, I mean, missing meals, so on and so forth. But too much of supplements, if it's not regulated, it's actually can be detrimental to your liver because, as I mentioned earlier, wherever they consume it, regardless, it has to pass through the liver. So all this will require the liver to metabolize it, and it could put a strain to your liver. I mean, the liver is essentially just like every other organ. For instance, I can give you an analogy of someone who runs a marathon. So if you run for a couple of miles, all right, no, Brian, you are I mean, sports person, right? So after a while, your muscle gets sore, so you will rest. So that same goes to the liver. So if you push the liver too hard, right, to the extent that eventually it will give up. Give up means that it might go into failure. So especially so when someone introduces itself to a lot of, I would say, unregulated products or supplements in hope that they might be able to achieve something out of that supplement. But it's a dangerous zone in a way that it might actually lead to detrimental effects to the liver. Worst case scenario, liver failure.
Yeah. Now, Dr. Chung, I want to take you up on that a little bit because a lot of times as athletes, people put themselves, whether you're an example of myself, I'm a cyclist, I'm an ultra long marathon, and I have friends who do ultra marathons.
Yeah.
What sort of stress does that put on our digestive system and our livers? Because yes, during this extended period of time, we are consuming food, we are obviously stressed, the whole body is stressed. We all have the illusion maybe that we are very, very fit and healthy. But is that an illusion or is that reality? Because we are putting a lot of stress which could be damaging our digestive system and our liver.
Not necessarily, but when you mentioned about stress that could potentially damage digestive system and liver, what do you mean by that? What sort of stress?
So what we do, for example, so if you're you're triathlete, you are ultra endurance cyclist, you are basically over an extended period of time, you are exercising, you are taking in artificial food a lot of times, which are which are all processed food. You may or may not be in a position where you are stressing your body because either insufficient water, for example, that could be a big impact. Also with these foods, they require you to have water. So if you're not drinking enough water, that's, I would think, have a detrimental impact on your liver.
I wouldn't say not so much on the liver because the liver has the capacity to compensate what we're lacking. Say if one athlete who goes into dehydration, it wouldn't impact the liver so much in comparison to the kidney. Dehydration has, I should say, will have a marked effect towards the kidney rather than the liver per se. So eating processed food, on the other hand, on of course red meat and so on and so forth, rather than it causing an effect towards the liver, it in the long run, it may lead to based on data and literatures, right? Processed food, red meat will lead to formation of clumps or abnormal cells and polyps and eventually colorectal cancer. Not so much to the liver though. I don't know, maybe Dr. Teoh have additional information in regards to this matter.
Dr. Teoh, what are your thoughts, Dr. Teoh?
About ultramarathon and stress and liver? No, it's no. In fact, right, as a marathon runner, you really use up your stores, and then you end up using up your body fat. So that in a way is a good thing actually. It decreases insulin resistance and in fact make your insulin very sensitive.
Correct. Just to add on itself, as an ultra marathoner, Another function of the liver, just to add on, right, it actually helps to regulate your glucose in your body. There are two ways of how the liver regulates the glucose in your system. So if you are participating in a heavy duty sports, right, you need a lot of energy. You need to burn those glucose off. So even if you're not eating, right, your liver can actually regulate the glucose production. If it's in your bloodstream by producing new glucose in a process called gluconeogenesis, and can even break down the glycogen storage, right, in order to release extra glucose for the energy they required in order to get on or continue on with the sport that you're participating in. Yeah.
I'd like to ask you both about medication and breakthroughs that we've seen in medical technology in controlling liver problems. I mean, maybe starting with you, Dr. Teoh, what would you say is noteworthy about this?
So for patients for my diabetes patients who has fatty liver, I am not a proponent of starting any medicines for the fatty liver because I feel like I'm not an expert in that area. But the one thing I really knuckle down is they need to lose weight. They need to lose significant amount of weight, not the 1 or 2 kilo kind of weight. You know, I often would propose for them to start 10% body weight loss. 80 kilos to drop by 8 kilos, you know, something like that. Because actually, I think that is just a massive, massive help with fatty liver, diabetes, cholesterol, high blood pressure. So you kill 4 birds with 1 stone, you know. So that is my main thing. I don't necessarily use any medicines for fatty liver.
Yeah.
What about you, Dr. Chung?
Yeah, in fact, just to add on, there's no specific treatment, or should I say an endorsed or approved treatment for fatty liver at the moment. Of course, there are few medications in the pipeline, all right? It's still in phase 3 of a study. It looks promising, but it only helps in individuals who already have an established NASH, a stage after the fatty liver, in hope that it will regress the fibrosis, but it's still within the pipeline. But at the moment, based on the literatures and evidence that we have, lifestyle modifications is still the mainstay of treatment in fatty liver, especially when it comes to weight loss, right? And the factors that contribute to fatty liver, all this have to be taken care of. For instance, if the individuals have diabetes, high blood pressure, and hyperlipidemia, or high cholesterol, all this has to be taken care of with helps of medication, and this will improve the fatty liver over the time. And yes, again, I agree, Dr. Teoh, what Dr. said, weight loss is important. 5% to 10% weight loss, right, has been proven to reverse the fatty liver. The percentage of steatosis within the liver proven by liver biopsy.
Now, Dr. Teoh, Dr. Chung, any final thoughts before we end today's show?
Definitely need to keep slim.
Keep slim. Okay, that's a good.
Slim.
How about intermittent fasting, Dr. Teoh?
Intermittent fasting. I'm a great proponent of intermittent fasting. Actually, I think it's great. Okay, but it needs to be done not in an extreme fashion. But definitely, if people are talking about 16-8, so 6 hours of fast, 8 hours of eating, I am all for it, especially people who are in the pre-diabetes stage or have fatty liver without diabetes. I think they should do that, because actually what it does is really it cuts down the unnecessary calories that people are consuming, even though they might not be that hungry. The other thing I always say to my patients is that it gives a chance for the pancreas to rest, because if you're eating, you know, and then you sleep for 6 hours and then you get up and then you eat again, you know, your pancreas never get a chance to rest, you know, and over time and an overworked machine, it just fails, you see. So that's where you get diabetes and things like that. So yeah, intermittent fasting is quite a good way, but not in an extreme way, by having a 20-hour fast or a 48-hour fast. That I'm not keen on, because actually there are other problems that are associated with that. I think 16-8, definitely yes.
Final word from you, Dr. Chung?
Yeah, as far as I'm concerned, liver issues or liver problems are very often without symptoms. So my advice would it's best to at least have yourself checked, all right, at least through medical checkout, routine blood test. Should there be any elements of transaminitis or elevated liver enzyme, get yourself further tested to look out for the root problem. Because once we identify the root problem to the elevated liver enzyme, if we tackle the root problem early, then it will put a stop to the progression of the liver disease. Yeah.
Now, Dr. Teoh, Dr. Chung, thank you very much for taking your time to be on your show.
Welcome.
Thank you very much for inviting us.
Yeah.
Now, I'm Brian Fernandez.
And I'm Jason Dacey.
And we've been speaking to Dr. Chung Chien and Dr. Teoh Wei Ling from Sunway Medical Centre with a look at digestive health and specifically understanding our liver health on BizTech's Health and Wellness Show. This video will be on our Facebook and LinkedIn sites, as well as our website, www.biztech.asia. Please subscribe or like our LinkedIn and Facebook pages. Thanks for tuning in.